Pre-operative patient instructions. Number 1, please do not eat or drink anything at least 8 hours prior to your hospital admission. That includes water, milk, or coffee. Should you have anything in your stomach, during the intubation, if you do gag, some of this gastric contents could go into your lungs and cause a pneumonia. Number 2, no aspirin, aspirin products, non-steroidal anti-inflammatories, or blood thinners at least 7 days before surgery. Number 3, please bring a current list of your medications and dosages to the hospital. Number 4, please take your blood pressure medications and diabetes medications with a tiny sip of water in the morning of surgery. The risks associated with a cervical spine surgery include cerebrospinal fluid leakage. Cerebrospinal fluid is the fluid that bathes the brain as well as the spinal cord. Since we are near the nerves as well as the spinal cord, there's a tiny chance we could get a little leak of that fluid. If a leak does occur, Dr. Ghosh will repair it at the time of surgery. Bleeding. Anytime we make an incision in the skin, there is a risk of bleeding. There is always a chance that you could possibly require transfusion. With cervical spine, it is very minimal. Infection. Anytime we make an incision in the skin, there's always a risk of infection. We do give you IV antibiotics both before and after surgery. There is about a 4 to 6 week window in which you could potentially require antibiotics should you get an infection. This could be either oral antibiotics, which is most common, or IV antibiotics. And in very rare cases, surgery to clean the infection is necessary. Hoarseness. Since we are pushing the esophagus and the trachea out of the way, some patients do experience some hoarseness, which sounds like they have a cold. They may also have some difficulty with swallowing. This can range for a couple days to a couple of weeks. Most of it does resolve on its own. Nerve injury. If a nerve injury should occur, this can result in chronic pain, paralysis, weakness, bowel, bladder, or sexual dysfunction. Dr. Ghosh does have a neuromonitor monitoring your nerves throughout the entire procedure to minimize any nerve injury. Instability. There is always a small chance that you could develop instability at other levels of the spine, which could require another surgery. General risks of anesthesia include stroke, heart attack, pneumonia, pulmonary embolism, as well as death.
My name is Felix-Anterior Cervical, and I'm here to talk to you about your upcoming surgery, the anterior cervical discectomy and fusion. The first part of the surgery entails Dr. Ghosh making an incision along the right side of your neck. Once that incision is made, he's able to go between the esophagus and trachea and the sternocleidomastoid muscle and gain access to the spine. Once he's down to the spine, he's able to remove disc material. Once the disc material is removed, then he can remove any type of bone spurs, both of which could be compressing on the nerves or your spinal cord. Once the disc is removed, he's able to put the PEEK interbody cage. Combined in that PEEK interbody cage would be synthetic bone material to help fuse over time. What helps to stabilize the spine while the fusion process is taking its place are the titanium plate and screws. There'll be 2 screws at each level and 1 long plate.
Cervical spine post-operative instructions. No driving until your first post-operative visit. No lifting greater than 8 to 10 pounds. No looking up, like changing light bulbs or going to an air show. No soaking in a pool of water, however, showering is okay. No running, but we do encourage you to do plenty of walking. Avoid straining. No dressing change is necessary for cervical spine fusions. Please call your physician assistant or MD for any temperature greater than 101.0, a fever of any kind with a headache or a stiff neck, increased redness or drainage from your incision, increased pain, increased numbness, increased weakness, or increased difficulty with swallowing.